No, it's fine. It happens. Dr. Nokukhanya is a medical doctor who is in the process of specializing in pediatrics, and she also does a lot of speaking on mental matters regarding our mental health. She is a speaker, she is a change maker, and she is a girl boss. And yeah, thank you for joining us, Nokukhanya.
Thank you so much for having me, Ndombi.
How do I address you? Nokukhanya is fine, right? Or Dr. Khanyile?
Yeah, Nokukhanya is fine. Please do call me Nokukhanya.
Okay, Nokukhanya. Okay, Nokukhanya, ngicela usikhanyisele around the issue of, I'm sure you get that a lot, around the issue of mental health, especially now in the time of Corona. But let's ask you, you've just come out of work, right? How are you doing in this time of Corona?
So for me, it's really not anything new. I think I'm still able to go to work and I still work my normal working hours. I think the only difference is now I'm starting to, because we're going deeper and deeper into the lockdown, I'm starting to feel like I miss my mom, I miss my friends. I am at least staying close enough that I can like FaceTime people and I'm able to talk to people at work. But I'm starting to get cabin fever. At work, we're having a great time. It's also very interesting because we're having to learn new things every day. We're having to change our protocols all the time as new information becomes available. But I think for me, I've always been an optimistic person. So I'm really excited to see the changes and what's going to happen at the end of it. So yeah.
Yeah. And have you actually started encountering COVID-19 patients yet?
So we haven't seen anyone who's tested positive. However, we do actually have to treat any patient who comes in with respiratory signs as a suspected COVID case. So that's quite interesting because we have to don the full PPE, we have to get the mask, the gloves, the visor, everything. So it's quite a lot of heat. That's the best way I can describe it. And it's quite difficult to have to maneuver all of this equipment around still trying to do our job. But I think we'll get the hang of it. It's new every day.
And are you scared at all?
For now, I don't think I'm scared. I think the one thing I'm more scared about is having to be quarantined on my own if I come into contact with someone or if I myself test positive. I think that's the thing that I'm really scared about because, at least I stay with my partner so I can come home here, even though we're, not seeing friends and family. But now if I have to be alone, I don't know how. So I'm really scared about that.
Yeah. Well, Dr. Nokukhanya, can you explain to us what is mental health? What are we referring to when we speak about mental health?
So mental health is basically a human being's ability to incorporate life's ups and downs, normal stresses, into being able to function at an expected level of society and contribute to your society. So mental health incorporates a lot of different things depending on your cultural background, your body, like what's going on with you as a person physically, and also takes into account your life experiences.
Wow. Yeah, because I think the thing that I've been doing a lot of research on trying to understand mental health, how anxiety and stress affects my body, and now I know things such as my sympathetic nervous system going into overdrive and exacerbating possibly my diabetes. Could you explain how would I know that my mental health is not in check, and what are the consequences of a prolonged period of mental health disability rather? Yeah.
So we can always look at our mood symptoms. So mental health has different categories of disorders. So there are mood disorders, things like depression, bipolar, mania, etc. And that will involve where you have mood instability. So you feel hopelessness, you feel very low, you feel like nothing makes you happy. Those are closer towards depressive symptoms. You also get manic symptoms where you start having increased energy, increased need for food or decreased appetite, increased libido, decreased libido, increased weight gain, increased weight loss, etc. So basically what you need to understand is that when there's a change from your baseline, and I think everybody can kind of know what their normal level of functioning is, and when there's a change that's actually causing dysfunction. And when I say dysfunction, it means that from what you're expected to do, you're unable to do that anymore. So if you are already working from home and you have to submit, reports or whatever, now you're just too tired to get up in the morning, or you're too busy because you're so manic and doing other things that you don't you're unable to focus on that. So you have mood symptoms, you have cognitive symptoms. So that's things like attention, concentration, memory that actually get affected. And then you actually have physical symptoms where you might, for example, feel, taste, see, hear things that are not there.
Wow. Okay. That's like me.
Yeah.
So what in the situation that we're in a lockdown, are we expecting to see a spike, especially because we're in a lockdown because of a pending pandemic? Are you experiencing or are you seeing a spike in people reporting that they are not okay?
So I wouldn't say that I'm seeing a spike per se, because also we are not getting a lot of people come into the hospital anymore. And unfortunately, mental health isn't really seen as an emergency condition unless you're suicidal or unless you're actually having physical symptoms from whatever is happening to you. So that's quite unfortunate. Having said that, I have been speaking to a lot of people, checking up on friends, family, and just in general on social media. And people are saying that they're feeling, firstly, a lot of anxiety about the future. People who are unable to work because their income depends on having close contacts, such as hairdressers, people in the entertainment industry. They're going through quite a lot of anxiety, but it's not necessarily anxiety to the point of dysfunction. It's just a worry that sits in their heart or in their mind. I have experienced and heard some people actually having physical symptoms, so having panic attacks, or really feeling severe depression coming on because of this dip. It acts as a trigger to exacerbate your symptoms and actually push you, because some people may be on the verge and or maybe controlling their mental illness, and they're actually now going backwards or into mental illness because of the fact that so many things are uncertain. It's difficult to control what's going around you, and so you feel like you're out of control, and your body and your mind, the hormones in your body, they also go out of whack.
Yeah. And so what would you say is a healthy prolonged period of anxiety? So now we've been in lockdown, I don't know, what is it, 3 or 4 weeks now?
Yeah.
Now let's say someone has been anxious from that time for 4 weeks, every day anxious, they're not sleeping. Is that long enough? Is it are they bordering on more damage to themselves? What is an okay period to say, okay, I'm going through an anxious period and it's okay. Let me go through it.
I don't think that it's clearly defined, because it firstly depends on the person. It depends on your coping mechanisms and your coping strategies, and also your experience of what's going on. So some people on day one, some people even before the lockdown was announced, were experiencing symptoms of panic attacks and anxiety. Some people are only now starting to experience that. So I think it's important, when you're having an anxiety attack or when you're really worried about what's going on, is to go back to the facts. And so that's difficult in a time like this, because there's so many theories running around. People don't know what's going on. There's so many scary reports that people are trying to share on WhatsApp and the internet. So I think we need to be aware of reliable resources of information, such as the WHO, which is the World Health Organization, the Gauteng or National Department of Health, Dr. Zweli Mkhize, who's the Minister of Health, releasing reliable information, up to date, up to the minute, daily broadcasts about the stats and what's happening, and also really listening to whenever the Department of Health or whenever the president speaks, because there's a lot of information that they give to reassure people. And I think with people with anxiety, once you have information, it can help relax you so that you at least can have some kind of grip on the future.
Yeah. Aside from like getting facts, what else would you recommend as coping mechanisms for people at this time? And I'm talking generally, because there's obviously different types of mental illnesses that people could be experiencing. But generally, what would you recommend other than the facts, beyond the facts?
So I'll break it out into about 4 phases. So I'll talk about the biological, the psychological, the social, and then I'll also talk about the spiritual. So just quickly, biologically, it's important to make sure that you're eating well. Even if you're not able to afford really high premium foods or variety, make sure that you're getting good fruits and vegetables. Make sure that you're having variety in your diet, and also that you're drinking a lot of water, because we're not moving a lot, we're not going outside a lot, so you'll become very comfortable, very lazy, you won't drink a lot of water. Also with your physicals, make sure that you're keeping active. So you don't necessarily have to do a whole hour-long workout, but even stretching in the morning, stretching before you get to bed, when you're working, standing up every 45 minutes to 90 minutes, so that you at least taking your eyes away from the screen. Even if you do like something new, learn a dance, do something moving with your body so that you're able to get that blood flow going. I think when we go to the psychological, I think it's important, if you have a mental condition or mental illness at the moment, or if you're thinking that you're starting to feel those symptoms, reach out to someone. So that could be a friend, a family member that you regard close, or even call the South African Depression and Anxiety Group helpline, or reach out to maybe your psychologist or psychiatrist. A lot of people are doing online things, so you can really get some help in some kind of way. And I don't think you should think, oh, I'm going to be a burden, or people are listening. We want to help you. If we look at the social, FaceTime your family, FaceTime your friends if you live alone. Talk to people as much as you can, especially if, some people are extroverts, so they need that interaction. Even if it's a different person every day, maintain that social connection, because even though we're socially distant, we're actually not, so it's physically distant, but we must be socially connected. And then spirituality, it's an important way, I think, especially for me, and for those of you who do believe in a higher power that is a spiritual force. It helps ground you, it helps maintain some kind of guide for you. And then the last thing I always give is a really cool tip for anyone with anxiety. So if you feel a panic attack coming along, your heart beating fast, you can't breathe, you're feeling very nervous, you're sweating, etc., I call it the 5, 4, 3, 2, 1 tool. So you look at 5 things around you that you can see and then name them. Then you look at 4 things around you that you can touch and you name them. Listen to 3 things that you can hear and name them. 2 things that you can smell and name them. And 1 thing which you can hear, which is your voice. And when you do that 5, 4, 3, 2, 1, it helps ground you, bring you back to the moment, and realize that you are still here. The future is too far away for you to deal with. You're right here in the present. And at this present moment, you are okay.
Yeah. Oh, I love that. I'll probably try to use that too. So moving away from, mental health in South Africa with regards to the lockdown, and talking about mental health in the country just generally, I think for me, the first week after the lockdown, one of the things that really hit me hard was, how are people who live day to day going to cope? And how are they going to, they already feel marginalized in everyday society. And now, they won't even be able to go and hustle, get that day job or quick gig that they used to get. They'll have to now actually rely on somebody to give them food, whether it's government or some organization. um, what is the mental health of our country, and what is this generally on a day, prior to lockdown? How would you rate it from a 1 being totally messed up country, or 10 where everyone generally is okay? And what can we do now going forward for those masses? Because the majority of our people are being marginalized. What can we do to make sure that they're okay? Because I find that a lot of the people I interact with on social media are like, stay at home, stay at home, stay at home. But those people can't stay at home. So, yeah, what is the state of the mental health of South Africa? And what can we do now after the lockdown to make sure that everyone is okay?
So it's very difficult to say what the state of the mental health is in South Africa, because at the moment, I think we don't have enough people aware that there is a problem, aware of the symptoms of mental illness, and also aware of where they can get help. So if people don't reach out and access those services, we as a medical fraternity are unable to see, oh, we need more allocated resources towards that. I think the second thing that's difficult in our society is a lot of us turn towards more traditional or more spiritual means to cope. So, for example, people will say, no, we are twasa instead of it's depression or mania, which it could be, but there could be another element as well. Or people might say, we just need to pray for you and that's it. And, someone who really is, I really love my God, and I really go for my anything towards any problems I have, I go straight for my Bible. I still do believe that you can work together with those things, and people don't know that, not
Yeah.
because it's right or wrong, but because they're just not aware of the information that's out there. I think the third problem is we have a significant population that consumes substances and abuses those substances. So besides the fact that we have mental illness on its own, we now have the advent of substance use disorder adding to that, especially cannabis and alcohol in our society. Because of the traumas that people, perform whenever they are intoxicated with these substances, they are perpetuating the mental illness in the country because of rapes, post-traumatic stress disorder, depression, etc. That is precipitated by all of these substances.
Yeah.
And then I think the last problem is, people in general just have a "I'm fine" mentality. They have a
Yeah.
"get over it" mentality. And
Yeah.
those two together, while they are okay in the acute phase, if you chronically do that over a long period of time, you don't really deal with what's happening. And I found that it's difficult to now say, are you okay because you're forcing
Okay.
yourself to be okay, or are you okay because you actually realize that it's not that big of a deal, or it's
Yeah.
it's something that you can cope with on your own?
Yeah. Yeah. Because the reason why I was asking that, and thank you for that, doctor, it really, yeah, it makes a lot of sense in terms, especially, uh, I'm just thinking of the people, not, doesn't even have to be cannabis or drugs. People right now are going through mental stress because they're not able to access alcohol
Yes.
or cigarettes. But I mean, the reason I worry about our mental states as a country is just, the fact that we have such high rates of rape, murder, and all of that means that we're just not okay. And I worry about the state going forward after this, when people are even feeling more dehumanized. I feel like it's dehumanizing when you feel powerless to be able to go and work and feel like you're being productive.
Yeah.
Um, but moving from that, doctor, uh, it seems that we do have, a rise of people seeing therapists. I started seeing a therapist for the first time last year, and I really wish I started seeing a therapist ages ago, because I've also realized that there's so much trauma that as a human being, it doesn't matter where you are, whether you're a high income person or not, so much trauma lives in us from a very young age, from, even 1 years old. Why do we still have a fear of saying I'm seeing a therapist? Is it really a weakness to say I'm seeing a therapist? Shouldn't everyone just see a therapist generally anyway? Or do you see a therapist?
So I used to see a therapist regularly. So the main reason I saw that therapist because I was going through a period in my life where things were chaotic. What I enjoy about therapy sessions, and a lot of people don't know this, is that you don't need a lot of therapy. You don't need like once every week for the rest of your life. On average, studies have shown it takes about 5 to 6 weekly therapy sessions for you to sit with the therapist before you get to a place of about steady state. That's where you're able to deal with whatever stresses life comes at you, and then you're able to manage them in a successful way. And then once a month or once every 3 months, you see your therapist. So that will just depend on what you've been through. I think a lot of people don't want to like say that they're seeing a therapist because two reasons. One is because you don't want other people to think that you're not coping. Even
Yeah.
even though for me, I see a therapist even when I'm completely fine, but because of the work I do, I don't know if maybe it's creeping into my personality or it's creeping into my work style the way that I am, and also because I'm prone to burnout purely because of the environment I work in. So it's more of a check-in. And some people look at therapy as, oh, you only need to go to therapy when you're sick, babes. So they want to minimize the stigma that is associated with therapy. But I think a bigger part is also some people are fearful of what's going to come out, because I think they know a lot of what's happening with them is because of particular events. And
Yeah.
going into that and digging that out requires you to actually do the work, because the therapy sessions is where you talk. And basically, the way that I like to describe it is that ball of yarn, it's all knotted and it's a whole long thing of wool. And you lay out all of your stories, your life story, your feelings, the way you cope with things, the way you deal with things. And the therapist then is able to make that a nice, neat ball for you to take out and manage. But they also give you homework. And I think that homework is very difficult because You have to talk to people who you maybe have not spoken to. And and you'll see a lot of people say two things. They'll say, one, this person just didn't give me any advice. They just let me talk. Or the second thing is, yo, hi, Losis, you wanted me to go and talk to Mang, and I'm not doing that, you know?
Yeah.
So if you're not willing to do the work, therapy is going to be very difficult for you because you're going to find a lot of resistance. And I think that's okay for you to acknowledge that. But reach out to get the therapy. I think the third reason therapy is so difficult for some people is because it's just not accessible. So it is quite expensive to see a therapist,
Right.
even though some medical aids do charge, do cover it. But
Yeah.
even in the state sector, you can wait up to 3 months sometimes to see a psychologist or even a counselor,
Yeah.
just because of the numbers that people have to deal with.
Yeah. That is a bit sad that there's a lack of access to it, even if people were willing to do it. And so, what are you finding in terms? Because I mean, I'm not a medical doctor or anything like that, but I've been reading up and I'm seeing that it seems like if you don't deal with your mental, emotional issues, you also start triggering physical reactions. So, the reason we have such a high rates or incidence of diabetes and all those kind of things in Black women as they get older, it's because they're not dealing with the traumas. Is there a link like that? How would you explain that, doctor? Like, why should people take care of it so that they take care of their physical as well?
So I think it's a couple of things. One of the biggest ones is when you have a lot of anxiety or when you have mental illness, it can physically change the makeup of your body. So, for example, if you're an anxious person, your sympathetic nervous system gets activated, and when that happens, your heart rate goes up, your blood pressure goes up. So people with diabetes and hypertension are more prone to get eye disease, worsening kidney disease, etc., because your blood pressure is elevated and you have a physical reaction to that
For a
anxiety
prolonged
that's not
period
being
of
dealt
time.
with.
Yeah, and
Thank you.
I'm saying that your body is in that state for a prolonged period of time, so it's gonna cause
Exactly.
damage. Yeah.
Exactly. So yeah, your reading is spot on. The second thing I think about it is if you look at people who are depressed and they may have eating and weight abnormalities. So because of that, I know a lot of people who suffer with depression tend to more towards the comfort eating and trying to soothe their souls with food. And you just want to sleep the whole day. You're not the person who's going to make a healthy meal, and you're not the person who wants to like go out and exercise because your body's just fighting with your mind at that point. So it predisposes you in that way because over a long period of time, you just want to feel good. You want something to make you feel good. Even though, some depressed and manic people actually tend towards not eating and having a reduced appetite and increased weight loss. So with mental illness, it's very important to know what your baseline is because, and I think over this time, a lot of people are going to find that difficult because now you don't have to go to work, you don't have to be at the office, so you can wake up whenever you want to, you can schedule your day how you want to. If you're tired, you can take a nap. And I think it's very important for us as a nation, because we are the generation that's going to go forward to teach
Yeah.
ourselves how to be disciplined so that by the time we get there or when we leave COVID territory, we're able to maintain that same level of function and actually take the nation forward.
Yeah, actually, now that you're saying that, I'm realizing that not much. I mean, I'm not spending much time on social media or even watching news, but we haven't done much as a nation to deal with the mental of people.
Yes.
I think that would be something nice to look at. Well, lastly, doctor, anyone who watches you on social media can see that you're naturally an optimistic person, very positive in a very infectious way. I love it.
Yeah.
Um, but let's say you have a day where, let's say, you lose a patient or anything like that. What are your immediate day-to-day coping mechanisms? Like, if you just come home now and you lost a patient, what do you do? And I'm asking this just as an example for people to maybe emulate. What gets you back?
So I think the first thing is for my job and my career, I feel like God sent me there. I feel like, and I say this all the time, I feel like I'm a real girl in a big world tasked by an awesome God to save little people. So I strongly believe that God has put this skill in me. He's put me in the places I'm at. He's put me on the hospital calls that I'm at with those particular patients, because not only am I going to be able to learn something from that patient, whether it's empathy, how to manage the condition better, etc., but also there's something in me that can provide comfort to that family. It's a very difficult thing that I've taken a very long time to come to. But for me, the prayer, the fact that I can pray to God and I say, thank you for this life. Thank you for, this patient that was here. For me, I don't really think it's such a sad thing for me. I think it's more sad for the family, and I always pray for them, because
Right.
I feel like they've lost their family member. I'm just gonna come back the next day and carry on my life as if it's another day. But for them, a whole part of their life has to change. I think the second thing I do is I try to maintain my physical strength. So I found that whenever I don't work out, my mood goes completely out of whack, and it's more difficult for me to cope with stress at work. So I try to do yoga. I do online workout sessions with my trainer, or when we get out eventually, I would love like go back to doing workout training every day, at least 3 to 4 times a week. I do drink a lot of water. I drink at least like a liter and a half, just because I'm moving around and I work in a neonatal ward. So the environment is hot, so I sweat a lot. And then I think lastly, I have such a good group of people around me. My family and my friends are really so supportive. And I think it's easy to be happy and know that I am loved. I think it's important for me to always maintain a baseline level of respect, no matter who I'm talking to. So when I go to work, irrespective of how people treat me, I never take it personally, because I know they probably have their own things going on at home. I just know that I must maintain my own level of work standard, and that must be excellent at all times, so that if anything goes wrong, I never feel guilty about the fact that I should have. I know I did the best for that person. And even if there is a little bit of guilt, I pray about it and I say, God, make me better. Help me,
Right.
improve the skill. Help me, work in an environment with team members that are all there for the greater good, and not for selfish intents. I think the last thing that I do is that I pray for my team members. I pray for the patients I go to work with, and I also pray for just the families of those patients, because, like I said before, I'm going to work, but these people's lives are being changed. So when I feel like I have that protection over me, it helps me deal a lot better with anything that's going on.
Yeah. So, like, what's your daily spiritual practice, for example?
So I wake up in the morning. When I wake up, guys, waking up for me is very difficult. Like, I literally have to set 3 alarms in a row. But when I get up, it's basically to read whatever devotion is set out for the day. So I've got that on my Bible app, and just meditate on that devotional mantra, or the word and the message in the Bible. And then just throughout the day, especially, I think a lot of people think you have to sit in one place and you have to get in the zone and pray. But
Right.
I think as I'm doing something, if there's a baby who's decided to crash and we have to resuscitate, the whole time I'm there, I'm just like, God, be with us, protect this life. I just go through it as like, I mean, I'm saying it in my head. I'm not there like,
Yeah.
and I think the most important thing for me is reflection. So reflecting, God, what could I have done better today? Who do I need to maybe talk to? Who do I need to reach out to? What is it that I learned today that made me a better person? And I think it's not necessarily time that I set apart, but it just always happens as my day goes on. The only time I really sit with it is in the morning, and then every Sunday, or whenever there's a thing at church, it's spending time with the worship, or listening to the word. Yeah.
Yeah. Last question, and this is
No problem.
comes from something you just said.
Mm.
That you are essentially working in the space you're in is where you feel this is your purpose, right? It's a space you're passionate about, and it makes it easier for you to then feel like this is where I'm supposed to be. What would your advice be? I don't know if you've encountered young women who find that they're not passionate about their work, or they feel they're not living a purposeful life. What is your view on ensuring that a person lives a purposeful life, and what's your advice for them to get there? Let's say they've studied a whole degree and realize this is not what I want to do. What would your advice be?
I think that would depend on whether you know what your passion is or not. If you know what your passion is, then it's easy, because it's easy for you to kind of direct things in a way that you're able to live out that passion, even if you're working in something that's completely unrelated to your current job, or to your passion. When you don't know what your passion is, I think that's when it's very difficult, because it's hard to advise you, and it's hard to say, oh no, but tailor it towards this. I think what you then need to do is really go through and sit. I literally go like with a tick box, like go engineering, like read up on engineering, think about it, and be like, okay, yeah, I could do this, I couldn't do that. Medicine, work through. And I think it's also important to know the difference between a passion and something that you really want to do.
Right.
Because a passion is something that, like for me, and people always say, how did you know pediatrics was your passion? When I did internship, I did pediatrics, then I left pediatrics, and everything else sucked until I came back to pediatrics. That's how I was like, even if you take me and put me in like Harankua, put me in pediatrics, that's where I'm going to shine, because I'm so, even besides studying, it's just part of who I am, whereas something you really want to do, when the reason that I say that is because if things get tough, your passion will make you still stay. When
Right.
things get tough and you just really want to do it, you'll just complain about it the whole time. You'll make excuses for it. And so the advice I would say to people is, do your research about what it is that you want to do. If the journey sounds difficult, but it sounds like it's something you could put up with, actually go and talk to someone who's in that field. Ask them everything. Ask them every little thing. What are your days like? What is your lunch like? Do you get holidays? How is your leave? Do you get money? Ask them every single question, because you don't really think about those things until you're in the profession and now you're stuck. Thirdly, I would say is to look at anything that would be in there to like forward yourself. So for example, in medicine, we have the option to specialize and super specialize. We have the option to do community talks where we speak to you and we share our information and our knowledge, etc. Would you be able to contribute to your community in a successful way? And would you be willing to do it for free? I think
Right.
that's the biggest question, because if you're not willing to do it for free to benefit other people, then I don't think it's really your passion. But at the same time, you mustn't sell yourself short. And the
Yeah.
last thing is, when circumstances that are incredibly negative come your way, if you are ready to give up the towel, throw in the towel and give up, is it really something that you're passionate about, or is it just something that you really enjoy doing?
Yeah, because I mean, as we're speaking about it now, I'm thinking that actually living or working in an environment or in a career where you're feeling passionate and purposeful probably goes a long way to maintaining your mental health, I think.
Definitely, babes. I work 240 hours a month. I work on weekends. Sometimes I miss birthdays. Sometimes I have to leave friends' parties early, and then I have to hear all the stories. It's like really sad sometimes, because you have to cover for someone unexpectedly. You see, I've seen the best and the worst of the human condition in medicine. But
Yeah.
at the end of the day, I still know that, there's like I can't explain it, but like I'm just good at what I do, man. And it's because I just know this is something that I really, really love, and I want to be here every single day.
Awesome. I think this is a perfect way to end our conversation. And just to say that when I first encountered you and I saw that you were specializing in pediatrics, I looked at you and I was like, as a mom, I actually would feel very comfortable.
I'm so
Because
glad.
yeah, you
It's
look
so
that
funny
way.
because the sisters always look at me and they're like, yo, you love kids. I'm like, they're like, do you have? And I'm like, no, babes. I like money more than I like children at this part of my life.
Yes, yes.
But
Take
I
your
am
time. Yeah.
so glad. Thank you so much.